understanding that how to come to Germany or what are all the things going on in Germany. Such things will be a motivation for most of the doctors. Okay, so can you hear me? Hello?
Yes, sir, it's audible. Sir.
Yeah, it's audible.
Yes, sir. You are loud and clear.
Yeah. So actually in 1982, I have reached in Coimbatore because I didn't like this Ayurveda, because I usually want to go for engineering. But somehow I reached in this Coimbatore, and the first 1 or 2 years, I was really not interested in Ayurveda. Even we were studying Vata Pitta Kapha and Padartha Vijnana and all. Even the atmosphere in Mavuthampathy, as a young person and all, most of our classmates were a little bit not so interested in this style. But when we reached in the clinical practice, automatically we have seen that there are changes happening into the patients and such things. So this makes us a little bit more interest in Ayurveda. Okay, but still that time also we were doing private, what you call private studies in modern medicine in Coimbatore Medical College. And we have done the surgery and we have done the gynecology and obstetrics without knowing the teachers of Coimbatore Ayurveda College, because we were so much interested to know what is happening in school medicine or allopathy, what we say. Yeah, but that gives really for me a real understanding of Ayurveda, but not through allopathy to understand Ayurveda. But that really, for me, it is very, very important to work in Germany. Yeah, but not like we are thinking that everything through allopathy and only for the medicines Ayurveda. No, because now I am practicing completely Ayurvedic treatments and Panchakarma, all these things in Germany. So that is the real understanding, also the modern medical knowledge. The only thing what I feel now is because I'm not so what you call or most of us are having not much idea about the technology of the modern medicine, because that should come into the curriculum, like all the scans and MRI and everything should be in our college. And then we can do the prognosis, not for the diagnosis, only for the prognosis, to show the world what happens with the parameters. Because orals, we always do something and nobody knows that. No, that is number 1 point. Second one is, even it is a one case, Ayurveda case, even one case you have treated and successful, that should be written in some of the what you call paper presentation, because you can look this care writer. That's a very interesting software that's from India. So you can start writing each patient, because you know that in Ayurveda, it's 100 patients to do a research protocol is not the correct way, because each patient is different, each symptom complex is different. So that should be highlighted to the world, or else people think that it's just like allopathy, just like school medicine. So this differences we should show that, because as a young generation, we should work for our own research methodology and our own publication things and all is possible. Then the world will accept also, because you don't ape school medicine for doing everything. No, so it's not through aping through school medicine to understand Ayurveda. No, it should be an understanding of school medicine only for the prognosis and only for understanding very important terminal, what you call critical conditions or something like that. No, so that should be the aim. And I hope that there will be sometimes an integrated medicine, there will be sometimes a complementary medicine, and there will be sometimes as an alternative medicine. 3 areas we can work with Ayurveda. No? So, yeah, so that is a small introduction about this part. And as I told you that in Gurukula, even the teachers, I don't remember all the teachers because there was no inspired teachers what we can really to get some information, because I only 3 people or 4 people I'm really connected with. That is, one is, you all know that maybe Dr. Murali sir, Dr. Murali Dharan, we say Murali sir, and then Dr. Shashidharan sir, Shashi sir we say, and Vasudevan sir. No, so these 3 people and one more, Ishwara Sharma and Musad sir are all there. But Musad sir, we have not taken much classes. But these 3 people really influenced for me in different ways in Ayurveda, because Murli sir's mathematical presentation of Ayurveda is very important. Shashi sir's adding and reducing the plants in every combination is very much interested. And Vasudevan sir, the theoretical explanation is very much important, and that really made me also one of the teacher or one of the person who can work in Germany, because then in 1989 I finished my course, and Dr. Murali sir called me for doing a course for Westerners. And that was a first course actually in India. Even BHU want to do that, but because of some currency problems and things like this, they couldn't do. So in Coimbatore, with Krishnakumarji's ideas, that we have done the first course, introductory course for Ayurveda with the yoga option. And I was the teacher for the Ayurveda, and Vasudevan sir was the teacher for yoga. So this we started from 89 to 95. So 89 to 95. And I also got a job in as a college lecturer. So in one way it was good with money wise and all, because you cannot do only one course and to survive in this. So there were 2 jobs, and I really interested with teaching people of Westerners, because you have to start from the very basic level for understanding Western people, because you cannot tell, you don't want to tell any modern medicine, because you should be very clear about the Ayurveda. You know, even you tell about the doshas or dhatus or anything. So that really developed for my teaching style for Westerners. And then in 95 I went to Italy for one of the international cultural exchange program. And 1.5 years I worked with some allopathic doctors, and we made an association, and I can work as a doctor in Italy. So that was very interesting part in Italy that time. So that time in Germany also, not so much Ayurveda was not there. But slowly I married one lady from West, and then I changed my country from Italy to Germany. And then I have established one Ayurveda Care Academy, and then a small treatment center. And then slowly the medicines were imported from Ayurveda pharmacy. Then I changed to Kottakkal, then I changed to Vaidyaratnam, and then I looked for some companies who will give me as what you call in glass bottles, and brown glass bottles, not the plastic, and no capsules. So like this, Vaidyaratnam people helped me for that, only for my export they have done in glass bottles and all. So this really also made some hike in Germany. And now I have a Panchakarma center, because I'm mostly specialized in multiple sclerosis. And the second one is the polyarthritis. So these are the 2 areas where I am really working, because one thing is we have a lot of patients in Germany, the MS and polyarthritis, and the people who have not done any oil treatments, no decoctions, nothing like. So the effect is faster than the Indian stomach. So that is one important. Second one is when you compare the patients from India and Germany, the Germans, when you tell something, they will do that. Even the nutrition, even the daily routines, things like this, they will accept and they will do that. Because here people tell that, okay, my grandfather was doing Ayurveda, I know Ayurveda. So nobody cares that. And we have only medicines and a doctor in Ayurveda here also. But it's not like that. It is a multifaceted or multi-modalities of Ayurveda should be done to every patient. That means starting with nutrition, herbs, dinacharya, rutucharya, medicines, Ayurveda medicines, and then yoga in asanas and pranayamas and dhyana. So these three things, plus the panchakarma, and this circle of even a holiday, even a what you call such things and all medical holidays, these are all important to change a person. You cannot change also immediately, but it takes maybe 1 year. So the consultation up to panchakarma, and after panchakarma, the patient is with us, because we write emails, we write what you call, there will be always a connection. So this makes them to change one by one. You cannot tell them to eat vegetarian tomorrow. So it should be slowly changing. So that is, for me, it is really, really interesting in Germany, almost all the European countries. So you will be thinking that how it is going on in Germany. We have 60 Ayurveda doctors, but most of them are the wives of IT experts. So in one way, they are sitting only at home because they are not doing much. Maybe 5 people or 6 people, but all the other 60 doctors are just wasting time. And some of them are also MD and PhD and all. So many people are there, but there is no chance for them because there is no, they are not taking any risk to do their own self-employment. They are always looking for a salary-based Ayurveda, but it's not possible because you have to start something. That is very difficult for them, maybe with the investment, maybe with the courage, or we study medicine in a different way here because we don't think about a very basic level to teach, because previously when I came in Germany, even they don't know what is ginger, what is ghee, and then it's like this, it's you have to start, because this is a very interesting part that a country doesn't know anything, you can really establish from the basic part. So this is, for me, it is very important, the study of Gurukula, because such style I made it there. It's the same style I made it there in this one. Even a patient comes to our center, they will understand an Indian way of life, the pujas or this one or that one. So they feel that how these people are working and without stress. So that is very important for them. It is, everything is trust. Everything is stress, and stress is the biggest disease also, that. So this is going on in Germany, and the 2020 June, that Germany has, in the German government, they have declared that Ayurveda is a medicine. Even in India, we don't see that as a definition of Ayurveda as a medicine, because we always sing the Samadosha, Samagnisha, Samadhatu, Malakriti. We always tell about that, but as a medical fraternity of modern medical fraternity, they cannot understand all these things. So at least a definition should be there. At least this medicine should be recognized as a national system of medicine. These are all very important, because this is even the, sorry to tell, even the salary what we are getting, most of the Ayurveda doctors are less than a therapist or less than a normal worker. So these things should be changed, means we have to do a lot of homework. And when we do this homework, only you have chances in others outside of India, because you can go to Australia, New Zealand, US, Germany, European countries, everywhere. But we should be very, very clear about our science, and we should very clear about how to explain these things in a special way, because you don't need to give explanation through modern medicine and then to establish Ayurveda. Recently, I have seen this GAF, Global Ayurveda Festival. Most of the conferences are myocardial infarction, and then talk about all the modern medicine. And in the end, they don't have a time to talk about the medicine. And the medicine is only some prepared medicines. No, then why we should study 5.5 years of Ayurveda? You can only do 1 year of Ayurveda for a modern medical doctor. That is only a pharmacologist to study which disease, which medicine. So this is, we are really losing this Ayurveda tattvas. No? So this is what really what I got from this Gurukula system of Ayurveda from Coimbatore. No? Even when I talk about some of the other doctors from different universities, sometimes they get a new picture with Ayurveda students or Ayurveda doctors from Coimbatore, because we have trained in a complete different way. So this is something which I want to tell. And about this chapter, Maharoga Dhyaya, that means I will explain some of the points I don't want to read the slokas and explain all these things, but one thing is I will explain what is in this chapter, and the Charaka's time, and how we accept this one, how we adopt this one, like this diseases, these symptoms, the 80 Vata disease, Vata symptoms, and 40 Pitta and 20 Kapha, how we see all these things in a present situation. You can do it in different way, that you can, a physicist will see different way, chemist will see different way. So, but I see as a mathematics, this complete Ayurveda as a mathematics. This is the idea of Muralisar, what I say, and how you can add and reduce some of the plants in our combinations. That also I will explain, because or else we will be only following what the tradition has explained. My grandfather has written about the manuscripts. Such combinations we will continue. But it's not that. That is a Charakas or Vagbadas or anything. It was a case history during that time. But we need that tattva. And with that tattva, you have to calculate the new medicine combinations. You have to understand each diseases, even it is a new in the name. In one way, it is all comes under this 140 symptoms or Vata Pitta Kapha, you know that. But how we connect that one, a new medicine, new disease, when I say multiple sclerosis, how you understand in Ayurveda, and which plants should be combined. This is very important, because then you go into another country, even in New Zealand or Germany, we have a lot of plants, and more, sorry to tell that, more hygienic, more no heavy metals, such plants are a lot. But people don't know that how to use. They only know their own herbal medicine. For example, valerian is a plant, valerian, maybe tagaram, you said. And this is used in insomnia. So there are, even in modern medicine, they are giving this as a tablet. But when you are an Ayurveda doctor, you will think that, hey, this plant is very interesting for sleeplessness, and it is a warming, vata reducing plant. So why don't I make an Ayurveda oil from valerian and do a Shirodhara? So this is Ayurveda concept. Or recently we made a Chavanaprash out of German plants, because amla is a medicine now. So you cannot import amla as a food supplement or novel food or nothing like that, because it should be a prescription from the doctor, and you should get only from the pharmacy. So this is what Germany is doing, because when the plants and everything is Ayurvedic medicine, then you cannot do a play, So here anybody can do anything, anybody can sell anything, So this should be restricted, and this should be give as more seriousness to the modern medical or modern society. Even here people don't know what is Ayurveda. So that should be that it's our capacity to explain all these things. And so this valerian I told. So recently we made a Chyawanprash, and we have a plant called Sandon. This is also in vitamin C rich, and people are taking as jam and all. So we made it in a combination with like the amla. We have also spices we put and all, and it's possible. So that is more effective for the local people stomach, because you have a universal principle and you locally apply. So here your intelligence will work, or else just right what is Kotakala has made the decoction kashayam Maharashnadi Ayurveda pharmacy also made. We only follow these things, and it's a big broad spectrum combination. Sometimes you don't need that. So when the big pharmacies are reducing or doing a single herbs extracts or powders, and then a doctor can combine for each patient, you will be more, you can more help to the patient, not too much medicines into the body. So that is a real Ayurvedic part, because you cannot go to the herbal garden and collect the plants, but you can do this way in 50 plants or 100 plants, very hygienically cultivated and well packed, and the patient comes and you combine this one, and this is more effective than the big combinations. Maybe Arishtam ghee and all, you cannot do that, but at least the combination of plants. So this is what I want to explain also in this chapter, how these symptoms are grouped in a mathematical way. Maybe this is only my hypothesis, and if you agree or if you are interested, you can work more with me or with another person who is thinking in this way. Or if you don't, if you find this is difficult, or this is not a good idea, don't accept it. Then I will take my burden like that. But or else we can work. And this part you can work also with computer experts who are doing Visual Basic or artificial intelligence. This is coming new. So your brain is explained through the digital parameters. We need that, or else we'll be always singing the slokas and nobody knows that what he's telling. We need that because the world is interested for Ayurveda, but we are giving in a different way. That's not a good idea. So for example, I was telling just to Dr. Jeevan in the same organizer, because in Germany now the yoga is reimbursed, and Ayurveda is a medical system, it is coming, and maybe within 5 years it will be reimbursed. You see how it is going on. And even the Ayush government is spending a lot of money, like 1 million euros or something, 3 years for the research project and all. Damanohar was also behind that. So such things are going more and more. So there are chances, and I make it short, there are chances outside of India, but it is not just going and get a job. No, we should work. Maybe it takes time, because I'm now 25 years in Germany, and slowly I want to come back. But it is in one way, it is one of the pioneer also. So many people are there, or mostly from German side. But as an Indian who worked as a self-employment, it was only me. And that also from this Gurukula system, or that power, what we got from this college. Good. So I will now slowly come into the chapter with a small mantra. Shakya yukto yedi bhavadi shakta prabhavidum nache devam devo nakhalu kushala spanditumapi adastvamadhyam harihara virinjadi viravi pranandum stotum va katamakrita punya prabhavadim Guru Brahma Guru Vishnu Guru Devo Maheshwara Guru Sakshat Parabrahma Tasmai Sri Gurave Namaha Namami Dhanvantari Adidevam Surasurer Vandida Padapatmam Loke Jara Rubhayamurtyunasham Tadaramisham Vividhaushadhinam Om Shanti Shanti Shanti. So in the end, maybe you can ask some questions if I'm able to answer. If I cannot, I will ask some of my friends or teachers or something, or somebody will help for that. But anyway, I will start this presentation. Maybe I share the screen. Okay. So it's visible? Hello?
Yes, sir, it's visible, sir.
Oh. So this is the chapter 20, Charaka Samhita Maharoga Adhyaya. No? So 1 second. Good. Yeah. So my company name in Germany is Ayurveda Care, and I'm just written that it's the secrets of disease. You know how it is. How can you decode? How can you explore the chapter? This is possible in most of the diseases or plants, or when you know this idea of decoding. No, decoding is also possible with the Sanskrit words. And decoding also is possible with the my idea what I'm going to do that. No? We have seen that this is the Yoga Chatushka. This is the 4th chapter of in this Yoga Chatushka, the Maharoga Adhyaya. First one was the Kiyanda Sharijiyam that you have heard from one of the Guru about the diseases, about the Shiro Roga and Hritroga, etc. And then the chapter continues with the Trichodhi. I think that Vasudevan sir has talked about that. You know, 3 different swellings and things like this is going on. And then it was the Ashtodariya, that is the 8 diseases with Sannipada, so Samanya Javyati. That also we have seen last time. And now it is the last chapter is Maharoga Adhyaya. So here it is explained mostly about the Vata Pitta Kapha, different symptoms or the single diseases in different tissues, dhatus, and koshta, dhatu, and also sometimes you see in marmas and the manas. No? So this symptoms are just we are studying from the slokas, but it is possible to group into this 4 categories. That means in the some of the diseases are in the koshta, some of the diseases are in the dhatus from jasa to shukla, and then some diseases are going into the manas, and some are in the vital organs. No, yeah. So you see, it is always in an increasing or chronological order from one disease to the next disease. When you say about Jwara, Jwara is in the koshta, Jwara is also slowly in the rasa. But Raktapitta comes in the next tissue. So that means one disease is more higher than the other one. So when you tell about brain tumor, that is going up to the Manchadadu, no? So if anybody is telling any of the diseases in any of the medicines, you can group this one into different dhatus or manas. So that gives you an idea that this disease is more dangerous or chronic or more deeper in this one. So your treatment will be different. Your what you call your plants combination will be different, no? Because it is a higher one. So you are, when you are taking back this disease, like we tell about the from the shakas and all to koshta, you are bringing back this ama. We can also say toxins, but better is ama. So ama comes back from the tissues back to this koshta. It takes time, but the idea is bringing back into the koshta and then to cleanse the with the panchakarma. No? So if you are always having a jwara, that means you are almost healthy. And even in a brain tumor, you have a jwara behind, but that's not shown. So this is also a modern concept now in European countries and all. We make a fever, and then you get cured. No, but we are suppressing from one disease to the next disease. So that is the, so in this this one we have 4 types of disease. That is the agandu, you know that, the exogenous, no, agandu. So now we are in a corona crisis. So that means this is an agandu. People are talking in several conferences we have seen, no? So trauma, all these things are agandu. So here also sometimes we need an intervention from the modern medicine, surgery and all. So it is only a emergency medicine and a surgery. This is the main 2 part for modern medicine. In the agandus, what is the terminal stages? So in this case, I want to explain also my small incidents, what happened, because I was in Germany for, now I am in Kerala, in Palakkad. So, but I in 2021, in March, I went to Spain and Rome for conferences and consultations. And this time in Madrid, in Spain, was a hotspot of corona, and also in Rome, it was Italy. You know that it was a hotspot. And then within 10 days, I was traveling a lot and came back home in Germany. And then I got a dry cough and a little bit fever, and I thought that it's some from the travel and the food. No, in Spain and all, you don't get much vegetarian, and even the food is at 10 o'clock in the night, because in Germany we almost all the people will eat at 6:30 in the evening. Then we don't take any food, and it's light food. But the meat is too much in Spain and Rome and all. But we are vegetarian, or I am vegetarian. But it was difficult to get food in the proper time. So when I came back, I was tired. I get all these problems, and then I don't know what happened. And I went to the modern medical doctor, and he doesn't want to touch me because maybe it is corona or something like this. So then I came back home, and then with some of the preparations like Vilvadi Guliga and Amritaristam and Vetumaran and all, my fever and everything has gone within 3 or 4 days, and then I started working. But it was in March, April, and then in June, I got my urine obstruction. There was nothing is going out. And then I went to the doctor again, but the water was filled up in all over my lungs and everywhere. And then they found that this is the heart and this is the kidney and things like this. And they don't want to check about the prostate or something like that. Little bit down, I told that please check the, but they don't do that. They only want to the cardiac and kidney because that's money. No, yeah. But anyway, they couldn't find anything. Then I went again directly to the urologist, and he found there is an adenome, a small growth, but it's a benign one, which is suppressing the ureter, and I couldn't pass the urine. Then he told that we have to operate. We need 7 days in hospital and all. So I have done the hospital emergency. Okay, done the operation. And but my erythrocytes and hemoglobin went down like 2 and hemoglobin like 6 or something. So again, next emergency, and I was at home and again went to the doctor, the hospital, and I was in intensive care unit for 3 weeks almost. Okay, so then they put also the erythropoietin, blood transfusion, so many things. So, okay, because I don't have a facility to ask or to get an Ayurveda doctor, because I cannot treat myself, that you know that, because there are, but the preparations are not available. And I don't believe actually some people to give my body to treat who has always this modern way of thinking. But anyway, I just ignored all those things and I just followed what the modern medicine is telling. Good. Then again, after 1 month or something, again to hospital, and things were all the tests, because in Germany, you know that we are paying health insurance, so you can do anything, because we don't want to pay directly that time, no, because it costs also a lot. Maybe my all these things were more than 20,000 euro. That means 16 lakhs or something, only for the Lasix infusion, for the water to come out, and only for the salt electrolytes balancing. That's all. But anyway, the insurance will pay. So people always go for the modern medicine because you have an insurance and they get all the medicines, all the checking everything there. In one way, it is bad. So they don't take a responsibility. And for Ayurveda and all, you have no insurance. You have to pay from the pocket. No? So, but anyway, I was in this intensive care unit. That's what I'm telling this. Agandu. Something happened to me, a traumatic case. Maybe from the corona, maybe from my stress or something like this. And even 1 year, we were closing almost all the